folks, and welcome back to another episode of Creating Change. I'm Jillian Walsh. I'm a registered dietitian and a registered psychotherapist qualifying here in Canada. I'm also an eating disorder specialist, and I work primarily with children and youth who've been affected by an eating disorder, as well as their families. So today we are here to talk all about refeeding syndrome. This is part of a series that we've started just a couple of weeks ago. So make sure you go back and learn about starvation syndrome and the refeeding process before listening to this episode. All right, so the first things that I want you to hear is that the refeeding process can trigger a medical complication called refeeding syndrome. This is something that can often require hospitalization as well as medical management, so it's not something that we take lightly. It's the main reason why we strongly recommend that folks are connected to eating disorder professionals as part of the refeeding plan, so that you are observed throughout the refeeding process. So first, let's talk about what refeeding syndrome is. Yes, it's a medical complication, but what does it look like? So usually refeeding syndrome presents as abnormalities in somebody's blood work. Most often it's a drop in potassium, phosphorus, magnesium, sometimes calcium, and sometimes sodium. We might see one of these levels off, or maybe all five. The tricky thing is though, is that folks don't normally have their blood work checked, daily. And what ends up happening is that we tend to feel the symptoms of those deficiencies before we actually have the blood work done. So if you have started the refeeding process without the direction of a healthcare professional and you're feeling unwell, be cautious, be curious. You may have triggered refeeding syndrome, which means that you do need a medical assessment as soon as possible. If you feel lightheaded, fatigued, or if you have a drop in blood pressure or heart rate, these are all red flags of refeeding syndrome, and we'd want you to seek medical help. It's something that can be reversed with proper help, but you do need to get in front of a medical health professional if you think that you might be experiencing refeeding syndrome. So let's talk about what are the risk factors for refeeding syndrome. I'll give you the top three. So one is a significant recent weight loss. Number two is a severe restriction in food intake over the past 7 to 14 days. And three is the presence of a prolonged eating disorder, usually presenting alongside starvation syndrome. So keep in mind, refeeding syndrome is not just associated to folks with an eating disorder. However, having an eating disorder is one of the significant risk factors. That's important. So there's a few things to know around preventing or at least reducing your risk for refeeding syndrome. One of the main things is when you start changing your intake with the goal of mechanical eating and starting the refeeding process, is to start low and go slow. There is no reason to rush the refeeding process in the community or the outpatient setting. So if you've decided that you're going to start the refeeding process, A, seek an eating disorder professional to help and guide you. And B, make sure you're starting very low and you're going slow. That is key. We want folks to take a proactive approach instead of a reactive approach. It's much easier to reduce your risk of refeeding syndrome than it is to end up with refeeding syndrome and trying to treat it. That is key here. Take a proactive approach, connect with an eating disorder professional, get your refeeding plan so that your risk of refeeding syndrome is minimal. All right, folks, that's all I have for you today. If you have any questions, drop them in the comment box. I'll be doing an FAQ video in the coming weeks, and I will absolutely grab the questions from the comments for that next video. If you've been enjoying our episodes, like and subscribe to our channel. And of course, hit the bell. You'll get notified of our weekly videos as soon as they're released. Bye for now.